My name is Tess, and if you've been watching my videos, great. If you haven't, that's totally fine. I will just give you a small little brief intro to what I'm going to be talking about, which is medications for stomach pain, and what I have found helpful. And so this is for like irritable bowel, post-infectious irritable bowel, gastroparesis, and Crohn's, or proctitis, or ulcerative colitis, or whatever you want to call it, which I've been diagnosed with all 4 in the last 2 years. I've never had stomach issues up until this point, so I've been very blessed. And this started 2 years ago with a really bad infection that was missed by all the doctors that I had gone to. And it literally got to a point where I was 5'8", 105 pounds, and 14 BMI. And the doctors were, doing different tests and stuff. And I finally was admitted to a hospital. And the one doctor, just off the cuff, well, maybe it's this infection. And SIBO is what the infection was. And it's an infection in your small bowel. Some GIs know about it. Some are pretty familiar with it. Some hardly even ever hear about it or deal with it. But it's an actual, when the bacteria from your large intestine gets swished back up into your small intestine, then you wind up with this awesome bacterial overgrowth in your gut. And it causes a ton of different issues. Bloating, motility issues, on and on and on and on and on. So, finally got treated for that, and then had H. pylori right after that, and then had C. diff right after that, and have been left with massive stomach pain every day, every moment after I eat. It's hell on earth. I can hardly function, and last year actually I've gotten better as the months have gone by. So I am starting to see some improvement, especially with like different foods that I can eat without my stomach just blowing up and being in complete pain, like searing, burning pain or stabbing pain. My pain has pretty much centralized itself to the right side in a very particular area, so that I can point to it and be like, hey, this is like exactly where my pain is, which, by the way, if you go to a doctor, they'll be like, oh, that's referred pain. Maybe your boob is actually the problem and you can feel it near your appendix. No, that's like, I literally had a doctor that said something similar to that, and I was just shocked. I was like, no, you know what? I know what referred pain is. And so there's definitely something to say about doing your research and making sure that you understand like what your conditions are and how it affects you and where your pain is. And me having diarrhea for 15 years after my gallbladder was removed, I definitely was familiar with what colon pain was when I had diarrhea episodes every day. And so I know exactly that my colon is what hurts, and it is not referred that far. Like that's just not. Yes, I understand that there is definitely cases where, someone had, a zit on their back or a zit, like a nerve bundle in their shoulder blade, and then it actually hurts under the rib. That makes sense. Like, I get that. But anyway, I don't want to go off into running into bad doctors. I will say though, definitely keep searching for an answer for you if you don't feel that you're getting treated right, or if you're not finding answers. And if it's interfering with your daily life, then it's not okay. You need to figure out what's going on. Become your own advocate and do a lot of research. So these medications, like I said, I've been diagnosed with several different things in the last 2 years, and we're still looking for answers. I don't, honestly, the last test that I had that pointed a finger to gastroparesis, I don't feel got the whole picture. And then of course we did a failed SITS test after that. So anyway, each one of these medications helps in a different way. And there's definitely, I haven't listed any opiates on here because an opiate's an opiate. Tramadol, actually, I will say this for gastroparesis. So here's the interesting thing. I'll talk about gastroparesis medications first, and then and irritable bowel as in a general, and then kind of open it up. So gastroparesis pain management is probably the worst because you don't want to slow your gut down any further. And the more you slow your gut down, the more symptoms you have. It could be pain, it could be nausea, it could be vomiting. Gastroparesis, you want to be careful with opiates. So opiates slow the motility of the gut down, and actually morphine is the biggest offender. Oxycodone is the second, and then it kind of like goes down from there, but morphine being the biggest offender. So if you're on morphine, you have gastroparesis, you may want to actually think about changing your opioid that you're using. I don't know where fentanyl lands. I know that I've met several people who are on fentanyl patches for gastroparesis. I have no idea where that lands, but tramadol, actually the most interesting thing, tramadol lands in the least delayed or least impact on the stomach is tramadol. So if you're looking for a gastroparesis pain reliever and it's an opioid, or for IBS or post-infectious IBS, and you're worried about motility, tramadol. Now we'll get into some other medications, and here's the thing. What works for you won't work. What works for me won't work for you, or may work differently for you. Opioids just mask the pain, and so there's a difference between masking the pain and actually kind of like removing the pain. And masking the pain is medical marijuana is just an awesome example of this. I do think medical marijuana can help with stomach issues, very much so. I've read so much information online in regards to not only medical research studies, but also social media testimonies of people that have used it, what they've used it for, how they've used it, how it's changed their condition, how they've been able to change the medications they were using. I always love when somebody says, hey, I was taking 50 milligrams of oxycodone in the morning and another 40 at night, and now I'm using medical marijuana and I'm only taking the 40 at night. Sweet. That is awesome. And I do think that happens all the time. Like, people are constantly finding out and surprised that medical marijuana actually has a purpose in treating a lot of different conditions, especially pain, nausea, stomach stuff, like the stuff that makes you just feel yuck all the time. It also helps with nausea, so that's a big one as well. So medical marijuana, if that is something that you'd like to try, or just marijuana in general, because I'm here in Oregon, it's totally legal here in Oregon. If that's something that you want to try, and even if you're a child, if you're a parent and you're looking to, if your child has one of these conditions, and if you're looking to help your child, there is quite a bit of information actually online for parents looking to help their children with this kind of treatment, because there is nothing worse than a chronic pain, chronic illness that flares continuously, that you feel hopeless, that you can't do anything about. It's not only just depressing and causes depression and anxiety and post-traumatic stress in the patient, it does this to families as well and loved ones as well. And so it's important to take care of yourself in that aspect as well. So off on the side of these medications, like, make sure that you're taking care of yourself mentally, because this is like the most taxing thing I think that I've ever dealt with in my entire life. And I've never dealt with a dark depression. This illness has brought that out. All right, so Medical marijuana, definitely something to try and to research yourself. And um, it does slow the gut down, but not as much as it in regards to reports researched online. Things that I've learned, it's not as offensive as opiates to the gut in regards to slowing it down. Um, it is one of those other meds, though, that can be just a masker of pain. And so when you're in pain but you just don't care, there's the difference. Whether it's masking the pain or if it's actually helping the pain at the source, so you don't feel pain at all. And sometimes you can't get to that point. When it comes to UC, Crohn's, proctitis, that's where you get into steroids. For the proctitis, it was masking the pain. It wasn't masking the pain, it was actually getting to the pain itself and relieving that inflammation. And so what I noticed for me, especially what worked better than an opioid every time I went into an ER, was Ativan. Ativan is a muscle relaxer to its key. And I actually had a bottle of Ativan that a doctor had prescribed for me to fly because don't do planes. I'm not even going to talk about it. But Ativan, I had a small bottle and I was just like, you know what? I really needed to sleep. It was right after I'd gotten off of a medication that just went south on me. And I took one and I was out and my stomach didn't hurt. And it wasn't that it was masking the pain. It literally, it did not hurt. And so that was like a huge aha moment of, okay, what is Ativan? Why all of a sudden am I finding out that I'm like, it's taking away the pain? I can feel a difference. I'm feeling normal. And so I went to my GP and asked about a different muscle relaxer because Ativan, the problem with it is that your body actually grows accustomed to it. You have a tolerance to it. And so the tolerance just keeps building and building and building. And so that's the problem with Ativan and using that as a constant pain reliever. So we tried every muscle relaxer on the books. And so Tizanidine, Zanaflex was one that actually did help. Zanaflex actually does slow motility down. So you want to be careful when you take that. Flexeril is one that does help. Flexeril does have an anticholinergic effect. So again, it is one that will slow the motility down. Anticholinergic, Benadryl. Think of Benadryl antihistamine. It slows the gut down. And that just has to do with acetylcholine and the way that our nerves react in regards to high levels of, lower levels of acetylcholine versus higher levels. So it calms the nerves, meaning everything just kind of slows down. Flexeril, Tizanidine, or Zanaflex, which is the other name for that. Baclofen. Baclofen worked the best for me. Baclofen, and with all my meds, I never want to grow I don't want to use these meds for a long period of time. My goal is to get off of all medications, is to not have to use these meds. Baclofen, though, does help speed the gut up a little bit. It actually helps the pylorus open, and it helps with esophageal spasms. And so Baclofen actually goes to kind of the source and actually helps like release and relieve the stomach area. I was on up to 40 milligrams of that a day at one point. So I was taking 10 milligrams with every meal and then taking 10 milligrams at night. Again, it helps the pylorus open up. It helps, the stomach actually to calm down, and from spasms, the constant spasm motions, for those to go away, especially in the esophagus area. Cyproheptadine, antihistamine. So anticholinergic effects again. However, cyproheptadine, there's conflicting info online as to whether it helps or hurts gastroparesis. So, or nothing at all. Because they actually do, cyproheptadine is prescribed to a lot of children, So if you're a mom and a kid getting on this, watching this, look at cyproheptadine. Some of the, okay, that also, all of that information stands for IBS as well. Some of the gut motility medication we'll get into. So Baclofen definitely helps at the source. And sorry, I had to step out and go take care of a few things and hit pause and then keep playing here. So the prokinetics that I've tried, and I find this interesting. So if you're having a motility issue, one of the ideas behind why the pain is there is because the stomach is actually not like moving correctly, and so the muscles are binding up and not, doing what they should, which makes a ton of sense in my mind. So one of the go-tos, the immediate prokinetic that everybody just jumps on, especially doctors, and it does have a black box warning that it could cause tardive dyskinesia as well as other issues, is Regland, metrocarbamide. That's the technical name, but the brand name thing is Regland. Look that up if you are looking up a prokinetic. Motegrity is a prokinetic that actually works in the upper gut, middle gut, and the colon. However, motegrity causes some pretty significant stomach cramping, as well as it does have an effect on your psyche. So depression is actually one of the big things that they claim that medication actually causes or has an effect, and it may cause depression to become worse. So you definitely have to keep an eye on that. That medication actually interacts with serotonin, 5-TH3 and 5-TH4, I believe, which a lot of that is in the small gut. So if you didn't know this before, 95%, I believe it's 95% of your serotonin's in your gut and only 5% in your brain. So whenever you're dealing with a psychiatrist, you can now tell them that you're actually treating your stomach instead of your head, because you know where those meds are going now, and where your serotonin is that they're screwing with. Okay, so motegrity, domperidone, I believe is how you say that one. So this one is not FDA approved. You can get it in Canada though, and most doctors are willing to send prescriptions, especially if you've been diagnosed with gastroparesis, to Canada. And I don't know, I just made my refill call to them, and kind of felt like a little bit of a drug dealer because I know it's coming from Canada. I'm like, oh my gosh, I can't even buy my meds in town anymore. Anyway, okay. To help with pain that is ongoing, and if it's extreme, and especially pain that's just that ongoing pain, because when I was taking Baclofen, I don't want my body to be reliant on these medications. The idea is to get off of them. The second idea is to actually find something that will treat the pain as well as other things. So treat the pain, nausea, or treat the pain and vomiting, or treat the pain and whatever, right? So that you're not having to take an anti-nausea pill with an opioid, with a muscle relaxer, because your muscles are totally tweaked out. The opioid just helps send you off into la la land, because really that's what opioids do, is they help you ignore the pain. They do sometimes actually cure the pain, but if you ask someone if they've broken their foot and they've taken a bunch of opioids, that's exactly what they're going to tell you, is that, yeah, I can still feel it. It's still like throbbing, but I could care less. Anyway, my idea is not to be on the Baclofen. I was on the Baclofen, the cyproheptadine, Ativan as needed, and the Regland and Motegrity all at one time. That made me go absolutely nuts. I slowly took out the cyproheptadine, slowly took out the Baclofen, slowly took out the Motegrity because it wasn't helping. It was actually causing some issues. And the other thing is too, is if you're on so many different meds, you don't know which one is actually helping them, which one's hurting. And so you always want to be at that least number. I always want to be at that least number possible of medications to help treat. So there are medications that help with pain for a little bit longer lasting. And this has been used for IBS, for gastroparesis, for Crohn's as well. These medications belong to the tricyclic medication family, so tricyclic antidepressant medications. They also help with nerve pain. They're prescribed many times for fibromyalgia. Yeah, it's not an antidepressant to fix your depression, because the thing is with these, you prescribe them in a smaller dose. Like nortriptylin's one of them. Amitriptylin's another, eval, Remeron is another, and Remeron is a tricyclic, except it's different. It's in its own little box. Remeron messes with a bunch of things. So it messes with your endorphins, your serotonin, not endorphins, norepinephrine. How did I get those two mixed up? It messes with your norepinephrine, your serotonin, and your dopamine. And it's an anticholinergic, Benadryl, right? Antihistamine, sleepy time. Yeah. That medication can cause some issues. And so, similar to the Regland, the Remeron is a prokinetic. But it's a prokinetic with a cost. And so tardive dyskinesia is one of those things, as well as dystonia. So I took Reglan actually for 2 months, was having dystonic effects, and my muscles in my back were just completely out of whack. My muscles in my legs were out of whack, and we did not know what medication it was, because at the time I was on a couple of new meds that we were trying for a period of time, and we had to eliminate one at a time. And that was horrible. Like, I was just like, I was a mess. And I did not slowly titrate off that medication because it was causing so many issues. And the longer I took it, the more issues it just kept protruding. Like, the issues were crazy. Anyway, Remeron, be careful with that. Doxepin. So the Doxepin is one of and the Remeron both have very high anticholinergic effects. Anticholinergic, antihistamine, Benadryl, lights out. So just remember that nortriptyline or Remeron and Doxepin, very high anticholinergic effects. Nortriptyline and amitriptyline. So the Doxepin and Remeron messes with a bunch of stuff, so actually it's supposed to help speed your gut up. So it's in a class of its own. Doxepin, on the other hand, the anticholinergic effect, it doesn't have the serotonin effect or the dopamine effect that Remeron has, so it actually slows the gut down because it has the anticholinergic effects, which has to do with acetylcholine, which has to do with the nerves, and so that's like a lot of research. Get into that. If you want to know your condition, research it, right? Like, do your research. Nortriptyline and amitriptyline, there's been studies for the amitriptyline. There's studies saying that it does slow the gut down. There's studies saying that it doesn't. And then there's studies that saying it's a wash. You know, it really doesn't slow it down, but it doesn't speed it up. So it's not, the best thing that you should be taking if you have a motility issue. So that's amitriptyline. Nortriptyline is amitriptyline's little brother. Your body actually breaks down amitriptyline into nortriptyline, which is just like, okay. So what's extra in amitriptyline? I have no idea. Okay. those are the nortriptyline and amitriptyline. These are antidepressants. You take them in smaller quantities than you would for an anxiety issue or depression issue. And they do tend to help with pain and manage it and kind of like knock it a level down. I will say I've been on nortriptyline now for a month and a half, and I'm adding, like, upping my dose a little bit to see if that helps. It's not really quite working, so I'm gonna go back to doxepin. Just doxepin, small amounts, small, like 3 milligrams is what I'm starting out with. 10 milligrams nortriptyline is what I'm starting out with. I do still have to take domperidone. Has helped and does help with stomach movement. I have not noticed a huge effect though for pain in regards to like on a regular basis. There are some people that swear by it. All of these actually that I've talked about, just you have to try them for yourself and figure out what works. Welchol, so for diarrhea, like Pepto-Bismol and Imodium. Imodium's actually the best. I wouldn't, Pepto-Bismol's kind of neither here nor there. It really doesn't help. It'll just turn your diarrhea black, which can be a little scary. Imodium definitely does help, but I was taking like 8 or 9 Imodium a day and still having massive diarrhea. When it comes right down to it, Welchol or cholestyramine. Cholestyramine is a packet that you add in some liquid or juice and you drink it. It does great. You don't want to take it because it's a binder, it's a bile binder. So what these do, Welchol and cholestyramine, if you have really bad diarrhea, especially if you've had your gallbladder out, these two medications actually bind with the bile and help with diarrhea. So if you haven't tried these, try them, especially if you have your gallbladder out, please. Okay, this is like, I'm going on a half hour of time and I don't even remember what I've talked about, but I hope that someone found this informational. Again, dealing with a chronic illness sucks. Like, and, oh, I'm just now remembering, for the nortriptyline, amitriptyline, Remeron, doxepin, for those tricyclic antidepressants, there was a little bit of advice given on Facebook, I think it was, out of one of the Gastroparesis websites. She said that her doctor suggested that those medications, within 1 week, you should see some difference towards it being a pain reliever. If you don't, you discontinue it. So if you're only on these meds for 1 week, especially these tricyclic antidepressants, 1 week is not enough really to give you a withdrawal. You might feel bad for a day or two, but it's not an actual acute withdrawal symptoms. 1 week though, for its pain relieving effects. If it is not giving pain relieving effects, or if you're not seeing a difference within a week, on to the next one. Because by that time you should be feeling some kind of effect. There are some people that I've been very surprised where they've taken nortriptyline and it takes like a month to kick in. And a lot of doctors will tell you like, hey, these take like a month to kick in, because you're not using it for the antidepressant or anxiety effect. Usually that's when that kicks in, not the pain relieving effect. So the pain relieving effect usually will kick in a lot sooner. Anyway, that was a piece of advice that I read that I'm passing on, that I hope helps somebody else. All right, take care. And yeah, I'll be posting a lot more videos as I gear up to go to the Mayo Clinic. Yay.